Blood pressure, or BP, is the force exerted by circulating blood against the walls of blood vessels. It plays a crucial role in ensuring oxygen and nutrient supply to tissues, facilitating waste removal, maintaining homeostasis, supporting organ functions such as the brain, heart, and kidneys, adapting to physiological needs like exercise and stress, and serving as an indicator of overall health. Hypertension is a chronic condition characterized by persistently elevated blood pressure, defined as 130/80 mm of mercury or higher. It is often referred to as the silent killer because it can progress without noticeable symptoms, leading to severe complications if left untreated. Hypertension can be classified into two main types. Primary hypertension, which accounts for 90 to 95% of cases, has no identifiable cause. On the other hand, secondary hypertension, making up 5 to 10% of cases, is linked to specific conditions such as chronic kidney disease, endocrine disorders, or other identifiable medical issues. Hypertension is categorized by blood pressure levels, as per the ACC and AHA guidelines. Normal blood pressure is less than 120/80 mm of mercury. Elevated blood pressure ranges from 120 to 129/less than 80. Stage 1 hypertension is defined as 130 to 139/80 to 89. Stage 2 is equal to or greater than 140/90. A hypertensive crisis, which requires immediate medical attention, is defined as blood pressure exceeding 180/120. Hypertension develops due to various triggers, including genetics, high sodium intake, obesity, and stress. Mechanisms involved include overactivity of the sympathetic nervous system, which causes vasoconstriction and increases heart rate. Activation of the renin-angiotensin-aldosterone system leads to fluid retention and vasoconstriction. Endothelial dysfunction, characterized by reduced nitric oxide and oxidative stress, also plays a role. These mechanisms result in vascular remodeling, which can lead to target organ damage. Clinical presentation, signs and symptoms. Hypertension is often asymptomatic in its early stages, which is why it is called the silent killer. Common symptoms include morning headaches, dizziness, fatigue, chest pain, palpitations, and shortness of breath. In advanced cases, symptoms may include retinal changes, nocturia, and neurological deficits. Several factors increase the risk of developing hypertension. Non-modifiable risk factors include age, family history, and race. Lifestyle-related factors include high sodium intake, physical inactivity, alcohol consumption, and smoking. Medical conditions such as obesity, diabetes, chronic kidney disease, and sleep apnea also contribute significantly to the risk. Hypertension involves multiple pathophysiological mechanisms. Overactivity of the sympathetic nervous system is managed with beta blockers, which reduce heart rate and cause vasodilation. Activation of the renin-angiotensin-aldosterone system is treated with ACE inhibitors, which prevent the formation of angiotensin II, ARBs, which block angiotensin II receptors, and MRAs, which block aldosterone receptors. Endothelial dysfunction is addressed with calcium channel blockers, which relax smooth muscle, and direct vasodilators, which relax arteries. Vascular remodeling and increased resistance are key features of hypertension. Thiazide diuretics reduce plasma volume and resistance, while loop diuretics provide strong diuresis for volume overload. Alpha-1 blockers reduce arterial and venous constriction, and central alpha-2 agonists decrease sympathetic nervous system outflow. Non-pharmacological interventions are the cornerstone of hypertension management. Dietary changes, such as adopting the DASH diet and reducing sodium intake to less than 2,300 mg per day, are highly effective. Regular exercise, with at least 150 minutes of aerobic activity per week, is recommended. Weight loss, with a goal of 5 to 10% reduction in body weight, can lower blood pressure by 5 to 20 mm of mercury. Additional measures include smoking cessation, moderating alcohol consumption, and managing stress. Pharmacological therapy for hypertension includes first-line agents such as thiazide diuretics, ACE inhibitors, ARBs, and calcium channel blockers. Second-line agents include beta blockers and MRAs. Additional agents, such as alpha blockers, central alpha-2 agonists, and vasodilators, are used in specific cases. Therapy is tailored to individual needs and comorbidities, with compelling indications guiding the choice of medications. The management of hypertension follows a simplified treatment algorithm. First, confirm the diagnosis with multiple blood pressure readings and assess the patient's cardiovascular risk. Lifestyle modifications are recommended for all patients. In stage 1 hypertension, treatment typically starts with one medication. In stage 2 hypertension, 2 medications are initiated. Therapy is adjusted based on follow-up assessments, and for resistant hypertension, spironolactone may be added, and secondary causes should be evaluated. Uncontrolled hypertension can lead to severe complications. In the kidneys, it can cause chronic kidney disease and nephrosclerosis. The heart may develop left ventricular hypertrophy, heart failure, or myocardial infarction. The brain is at risk of stroke, transient ischemic attacks, and dementia. The eyes may develop hypertensive retinopathy. In emergencies, hypertensive encephalopathy can occur, requiring immediate intervention. Key evidence-based guidelines include KDIGO 2021, which recommends ACE inhibitors or ARBs for patients with chronic kidney disease, with a target systolic blood pressure of less than 120 mm of mercury. The ACC and AHA 2017 guidelines emphasize lifestyle changes for blood pressure greater than or equal to 130/80. The ESC and ESH 2018 guidelines recommend dual therapy for stage 2 hypertension. The NICE 2019 guidelines highlight the ABCD algorithm and ambulatory blood pressure monitoring for accurate diagnosis and management. In conclusion, hypertension is both preventable and manageable. Lifestyle changes, such as diet, exercise, and stress management, form the foundation of treatment. Medications are tailored to individual needs and comorbidities. Early diagnosis and effective control of hypertension are essential to prevent complications. Remember, hypertension management is a lifelong commitment.